Welcome to the Inside Out podcast. I'm Michelle, a life designer coach, nutritional therapist, leader in Run Fitness, and the host of the Inside Out podcast, bringing wisdom and experiences from inspirational people, fellow entrepreneurs, and from within my own life journey, supporting you around the globe to elevate your health and well-being and achieve the life you want to achieve. I am super excited for this week because we welcome Emma James to the podcast. Emma is the owner and creative lead to a group of 3 companies that have an overarching role to provide healthcare and wellness solutions to the general public and large corporate organizations. Emma offers private physiotherapy to her local community and is the founder of James Corporate Health, which is a bespoke healthcare solutions provider for all businesses, helping to drive down the cost of absenteeism and increase productivity and profitability of staff. Emma James has a team of multidisciplinary healthcare professionals and wellness providers, all working together to provide a holistic approach that is personalized to her clients. So, without further ado, welcome Emma to the show.
Hi there, it's fabulous. Feel Good Friday today.
Absolutely. Before we go deeper in today's discussion, for the listeners that don't know you, did you want to share a bit about you and your journey and the evolution of the Wellness Hub with particular focus on what 3 things would you tell your younger self now?
So the Wellness Hub itself was as a result of quite a traumatic time in my life. During COVID, I had a well-established physiotherapy practice and 2 or 3 other businesses, and we were doing really well. We had 3 corporate gyms and big contracts within the government. And sadly, as a result of COVID, we lost all of that overnight. And I also went through quite a lot of personal difficulties and challenges. However, during that time, I knew that I needed to try and pivot my business and pivot what I was trying to offer. And having been a physio for, at that point, over 20 years, I decided that I wanted to come away from such a clinical space and create a more community-based environment, which is why the Wellness Hub was created. And essentially, it's a physiotherapy clinic. We offer massage, we offer physio, acupuncture, we offer health solutions, nutrition, well-being solutions in terms of facials and anything that you can do to improve your overall well-being. We also offer pelvic floor rehabilitation using the Pelvic Power, which uses magnetic therapy to stabilize the pelvic floor. And we have just added cryotherapy, which is whole body cryotherapy, to our plethora of services. So essentially, I've created an environment where people are able to drop in, have a chat. We've got a chill and chat area that we've just created where we offer sampling of non-caffeinated teas and mushroom supplement coffees, just so that people can engage in their overall sort of health and wellness. And because we don't have a waiting room per se, and I've created a shop environment, people are much more likely to come in, have a conversation, and drop in and just, if they feel that they need a little bit of support or they need to see a friendly face, then that is what we are creating within the Wellness Hub. So essentially, in a nutshell, it's a health and wellness emporium based within the community and driven by the community's wants and needs. Does that make sense?
Absolutely. And, I love the fact that we are looking at more community based. You're working with lots of different professionals, including myself, and we make it very specific. I think the thing that is really exciting is the Cryo Hub and the launch of that, which I have experienced myself, and I think would be very beneficial to a lot of my listeners to kind of learn a bit more about it. As you know, my community is many with athletes, and very busy women that are juggling training and lifestyle. So can you just give us an overview of what it is?
So essentially, whole body cryotherapy is cold therapy. It is essentially, I don't know if you've ever heard of Wim Hof, it's Wim Hof without getting wet. So as a busy mum, single mum now, and running, rebuilding my business, I, understand the benefits of cold water therapy. However, I don't have the time, energy, or inclination to want to fill up an ice bath with thousands of litres of ice or go swimming in the sea. However, whole body cryotherapy gives you the same effects, but it is quick, easy, you don't get wet. So I'm in there for 5 minutes, 3 times a week, and essentially you're stimulating the vagus nerve, you are increasing your circulation, you're flushing out a lot of the toxins and the pain chemicals. You get a big release of dopamine, which helps in terms of your feel-good hormones and also helps to stabilize your other hormones, so estrogen and progesterone and your testosterone levels. And you get a massive kickstart with your metabolism. So for me at 47, being menopausal, I really struggled with weight gain around my abdominal region, struggled to fit in exercise. And although I focused on my nutrition, it's a challenge, right? We're often driven by stress, cortisol, anxiety, oh, I'll just grab a sandwich, or I've had a really long day, so I'm going to have a glass of wine. And what I've found with the whole body cryotherapy personally is that it's significantly reduced my cravings for sugar, and it's helped me make better lifestyle choices. And having mapped it on my Garmin, I also am seeing that when I use the cryo regularly, my base metabolic rate has elevated. So it's part of our suite of biohacking modalities that we use. So, there's lots of research at the minute around changing your metabolic base rate and your overall well-being by adding some biohacking hacks into your life. So there's lots of research around cold water therapy and the benefits. And it's amazing that we have entered this space, and it's in addition to the wellness services that we provide, but it's in a high street environment, it's in a comfortable, welcoming environment. So it's not just for people who want to have a spa experience, it's not just for the elite athletes, or in terms of price perspective, it's not something that we want to create so that we price people out of the market. It's something that we want to have greater access within the community so that everyone can reap the benefits.
So I'm just curious, because this is like fascinating, and clearly you've done a lot of research on it. Obviously, for centuries and centuries, it has been noted throughout different countries that actually to stimulate the vagus nerve, we should use like the breathing technique. From what I'm hearing is that, and that is for a number of reasons, as you say, to reduce that level. Are you now saying that, and Wim Hof was one of the things that came about because, like yourself, Wim Hof was going through a traumatic experience and he felt overwhelmed and did the cold therapy to like really foam in on the sort of like the breathing. Are you saying that same concept is just stimulating that vagus nerve, you're breathing through it and lowering it, but more in a total body environment?
The point is that absolutely all of the breathing techniques are essential. They are imperative in terms of making the oxygen within your system a bit more hypoxic. So absolutely, we do a lot of breathwork classes at the Hub, and in terms of doing that deep guttural breathing can help calm the vagus nerve in the same way that doing some somatic exercises and opening up your pelvis and stimulating your sympathetic nervous system has a calming effect on the vagus nerve, in the same way as cold exposure, because you get a big surge of you change the way in which the blood is supplying. So you get a big surge in vasoconstriction and vasodilation. So what that does is it helps to reset and recalibrate a lot of the systems within the central nervous system.
Just slightly digressing here, because as I say, fascinating subject, is something that is dear to my heart, and I'll bring it back in a moment to more of athletes in my community. But I had noticed from your recent sort of like campaigns is that potentially could there be any benefit for children, particularly children that suffer on the spectrum of ADHD, and lower in tone?
Yeah, so we're finding that I have two children, 8 and 12. They're not neurodivergent, but they have high levels of anxiety, exercise, etc. So post-exercise muscle soreness. So we've been finding that you can put kids in as low as 6. And there's loads of research in terms of calming down overstimulation to the sympathetic nervous system and helping to regulate normal touch response. So we have lots of kids and adults that come in with ADHD and use the cryotherapy as part of their overall well-being management experience. We've got patients that are addiction sufferers, so people who are struggling with alcoholism and drug addiction. There's a lot of research around using cryotherapy and cold water therapy in conjunction with other modalities to help manage that addiction. So there's a lot of research to do, but there is lots of evidence that clearly demonstrates the benefits. And I've seen it clinically. I've seen patients with neurological headaches, migraines, long-term pain and dysfunction, experiencing episodes of pain relief and euphoria and calming the sympathetic nervous system after being in the cryotherapy. So absolutely, there's evidence from a clinical perspective and from an experience perspective, and there is also research to show that whole body cryotherapy can have a positive effect on syndromes such as ADHD and neurodivergency. Absolutely.
So as you know, many of my listeners have started and in the process of doing marathon training. Equally, we've got a number of events that are coming up that are a mixture of trail, ultra, halves, even to some people starting couch to 5K. And I know that from my own personal experience of using this, it's effective in reducing inflammation and pain and wear and tearing muscles. Can you just go a bit more into detail how, if you are an athlete, and when I say an athlete, don't envisage, like a Mo Farah, but everybody that does an intensive amount of training and working towards a specific goal and achievement is an athlete. How would the therapy actually benefit them more specifically, and what sort of time of sessions and how many would you recommend?
Well, so obviously everybody's different, and so we assess each person individually, and understanding what their training protocol is and what they're trying to achieve, we can establish, how many sessions they may require and the frequency of those sessions. But there's a lot of reported evidence around the use of whole body cryotherapy for injury recovery. A lot of our elite athletes will come and use the cryotherapy on their rest days. Also, after an event where they've overtrained, we've got a lot of high rocks athletes that will use cryotherapy as part of their rehabilitation and injury recovery. So the way in which cryotherapy works for injury recovery is same thing, flushing out a lot of the toxins and the pain chemicals by you having a huge uplift and surge in circulation. So it's like doing Control-Alt-Delete on your computer, and what that will do is you flush out a lot of the toxins and the pain chemicals that build up. And as a result of that, you will allow, you get rid of, flush out a lot of the lactic acid, you reduce the onset of DOMS. And yeah, I use it a lot in conjunction with my physio. So for example, if I'm doing, acupuncture, or I'm doing soft tissue manual release, I will then do cryotherapy with my clients afterwards, and it speeds up that acute inflammatory stage of healing, and absolutely optimizes my results.
Excellent. We've talked a lot about the benefits and areas that cryotherapy can be used. Are there areas or specifics where it should be avoided?
Essentially, there are no major contraindications. You wouldn't want to use cryotherapy immediately post-operatively if there was an open wound, because obviously you've got an infection concern. You wouldn't want to use cryotherapy if you had an unstable heart condition. But other than that, the great thing about cryotherapy is there are very, very few contraindications. And essentially, it's a treatment, and it's an experience that if at any point you feel uncomfortable or you don't enjoy it, you can immediately halt the treatment by just coming out of the chamber. So I think that gives people a lot of comfort. If there is a degree of anxiety around claustrophobia, because the chamber is open, not when I say open, I mean transparent, you can see out, you're not locked in, and you have a therapist with you at all times. Lots of our patients who perhaps may have had symptoms of claustrophobia have actually found that has improved after going into the chamber.
That's amazing. Interestingly enough, have you had any experience of using it with pregnant women?
At the minute, I'm just doing some research into it to see if there are any contraindications as to when it wouldn't be appropriate. At the minute, it's not something that I'm actively advocating, not because I think that there are any contraindications. It's that I just don't know enough about it. It's an area that requires a bit more research for me, to see whether it would, my clinical reasoning would think actually I could see the benefits and could see the clinical reasoning as to why the therapy would be a good adjunct. However, personally, I haven't used it with pregnant clients, only because I haven't done enough research into it. So it's not something that I would recommend at the minute, because personally I haven't done enough research.
Okay. And obviously from what I'm hearing and you're sharing with us, it's very much something that would complement a lot of somebody's well-being with other therapies like coaching, nutrition. In terms of, I suppose, really chronic pain conditions, and my thought process going with this is very much we've got this, to me, what feels like a separation where you've either go down the conventional route of medicine, okay, and not so much to use holistic therapies together would be your own choice and your own sort of like funding. And certainly with chronic pain conditions, it's very much heavily managed, from my experience and research, along with a lot of conventional medicine, i.e. tablets. Have you experienced how that, like the therapy, the cryotherapy can help with chronic pain conditions? And do you ever see there may be a world where actually it becomes a point where the two will meet, and it would be a recommendation that doctors and nurses would advertise?
Absolutely. You know, as a healthcare professional, you know, I'm a chartered physiotherapist, and I'm a member of the Health Professional Council. You know, I am a medical healthcare practitioner. You know, at my core, and a lot of these therapies, you know, can be and should be used alongside, you know, medication and you know what might be considered the normal route for the treatment of lots of these sort of symptoms. You know, for example, we've had lots of experience with patients who are experiencing fibromyalgia, rheumatoid arthritis. They're using it alongside medication. You know, I'm not an advocate to say that we should stop all medication at all. I think that it's about understanding when medication is appropriate, and that you know, lots of these therapies should be used as an adjunct, and can be used to improve overall well-being. You know, lots of people who have chronic long-term pain and low levels of energy are unable to exercise. They have poor mood. They have high levels of malaise, high levels of anxiety and depression. You know, we all know the benefits of movement. We know the benefits of good nutrition. But sometimes when you are in a spiral of mental health, anxiety and or pain and dysfunction, you know, it's very difficult to start to make the right choices. And in the same way that I said earlier about, you know, the whole body cryotherapy is something that we would use as an adjunct. So it's part of our biohacking suite of services. So in the same way that there's huge, you know, drive to journal and talk about your mental health, there's a huge drive about getting up, moving, being in sunlight, you know, thinking about eating less processed food, you know, thinking about reducing your alcohol. All of these things, if we can look at things a bit more holistically, you know, we have, as healthcare professionals, perhaps some of us become a little bit more narrow-minded, and if we don't know enough about something, then we are more inclined to say no. But I've had lots of patients who have chronic migraines, you know, post-traumatic head injuries. There's loads of research around the use of whole body cryotherapy in improving concussion. And that's something that's used a lot in high level athletes where you've got a contact sport such as rugby. So, you know, the research is there, the research is coming. And I think that at the end of the day, it's not going to make you worse, right? So it's a bit of a suck it and see exercise. But I would love to see a world where it was more available in the mainstream, and that it was used as an adjunct to, you know, mental health, physical health. We can get people to start taking more control of their own well-being. Then they start to take a bit more responsibility. You know, for us, it's an amazing opportunity, especially for men, to talk a little bit about their mental health and their anxiety, because it is something that is quite community-based, and the environment that we've put it in enables people to talk about the experience, and because it's a welcoming environment, as you know, you've used it yourself. There's times when you've come in, you've been having a bad day, and I've been like, come on, Michelle, get your bod in the pod. And you come out and you're like, Emma, I feel amazing, you know, thank you, I feel so much better. And sometimes we just need to just change a few variables, right? So that things are a bit more favorable, so that we feel, you know, get that dopamine hit, so we feel a little bit better, so we can make, you know, better life choices. So absolutely, I think it should be used as an adjunct, and there are many things that we should be using as an adjunct. And it shouldn't be holistic therapy or, you know, biosocial medical therapy, you know, that are running in tram lines. There should be much more cross-pollination between these services and therapies.
Absolutely, and sharing podcasts like this, I think, is raising an awareness, and all we can do as therapists ourselves and professionals is to make sure that we are, you know, working together and telling the benefits and increasing the awareness amongst the two sort of like worlds. I suppose really just before we wrap up, is there anything that you kind of like really feel in your stomach, in your heart, that you would like to share with our listeners? Have we anything that we may have missed?
Really, I think we've sort of covered everything. I would just certainly say that, you know, somebody who, you know, I'm 47. I've been through the fire. You know, I've had a really, really difficult time the last 4 years. I have had times, and I have been to the place, the dark place. I have, you know, considered taking my own life. And I look back now and I think, gosh, you know, I'm so lucky to be surrounded by so many incredible people and to have been given the opportunity, you know, through my own blood, sweat, and tears and support to rebuild my business. And, you know, what I would really like to say is that, you know, why don't we spend a little bit more time collaborating with each other and lifting each other up, and then we can all rise together.
That's perfect and totally beautiful. That really has touched my heart. Thank you. So my friends, I hope that you found this show useful. Arming yourself with the benefits of holistic therapy and ice therapy. In the show notes, I will include Emma's details and how to reach out to her. And as we all know, Inside Out works with partners to offer a holistic experience. So please connect with me if you wish to explore any further how I can support. And equally, we will be working with Emma James and her team in the future to make sure that everything is available so everybody can lead an optimized life. If you like this episode, be sure to subscribe to the show, share, and follow us on social media. And as always, I thank all my listeners for listening. Be kind to yourself, elevate your health and well-being from the inside out to achieve the life you want to achieve.